Hamilton Center has been serving the community for over 50 years, growing and expanding access to services for communities all across West Central Indiana.
Way back in the beginning in 1971, and actually in the 60s, there was a whole lot of community development, fundraising, partnerships that enabled Hamilton Center to even be established, federal and state support, as well as all of our local partnerships that we have in our communities have enabled Hamilton Center to develop and grow. Also, I would be remiss without saying terrific leadership. We've had fabulous CEOs who have moved the corporation forward. We've had supportive board of directors, and most importantly, we've had hundreds and hundreds of staff who have worked here and really contributed to the mission and vision of the organization.
With 50 years in the books, the future looks bright for Hamilton Center, as well as the advancement for mental health treatment.
Stigma has been reduced. I do believe we've come far, but we have still great road to accomplish in that. You know, stigma was so profound in the past, often because people were taken away and institutionalized. And as we've talked more about mental illness, as people understand it as a true illness, and then of course we've had advances in treatment. Treatment has evolved from just looking at mental health and addiction treatment to now looking at whole person health. And so Hamilton Center has expanded in that area. We now provide primary medical care and other health care services. We've expanded access, and treatment has just sort of evolved to include the entire person.
But addressing mental health is a group effort. Hamilton Center is committed to working with other organizations to ensure patients are receiving support in more ways than one.
Very often we will see people who need food, who have housing insecurity, who have other needs besides mental health, and we're able to collaborate on treatment and on needs. People donate to our Hamilton Center Foundation, and that has supplemented our funding in numerous ways. And so we rely on that community engagement and community support for the future.
Looking back, they believe the original founders of Hamilton Center would be pretty proud of how far they've come.
Catherine Hamilton, who was an advocate both locally, statewide, and nationally, she had a sister who had schizophrenia, and she had to basically send her sister to an institution without much hope of any recovery or seeing her again. I believe the founding fathers of Hamilton Center, particularly Catherine Hamilton herself and other community leaders who made Hamilton Center a reality, would be so pleased at the progress. I don't know that they would have envisioned Hamilton Center in 11 counties with the depth of services that we offer, with 623 employees statewide providing that treatment. I think they'd be pleased. I think they'd understand there's work still to be accomplished, but I think they would be awfully happy at the progress.
The celebration of Hamilton Center's 50th anniversary highlights one very important initiative they take great pride in.
We were able to provide free suicide prevention training to our communities. That was one way we wanted to give back in recognition of our anniversary. We will continue to provide all kinds of training for the community. Suicide prevention is one area that we feel really strongly about. We believe it is realistic to think about zero suicides, and so we will continue to talk about it throughout our communities. I just want people to know that Hamilton Center is here for the long haul and will continue to be strong throughout our communities.
Hamilton Center is hosting its annual fund drive from November 1st through December 31st. Donate today and join the foundation's mission to strengthen the community by providing consistent and lasting support to Hamilton Center as it provides the highest quality and integrated health care to West Central Indiana. Make donations at hamiltoncenterfoundation.org/donations or through their Facebook page.